Hi, everyone. Welcome to RxConnect. This is a podcast brought to you by the Pharmacy Operations Department with American Oncology Network. I'm Cassie Perkey, and I'm one of the oncology pharmacists with the network. And RxConnect is a monthly podcast where we break down updates in oncology pharmacy as well as practical tips for patients that are managing common cancer treatment side effects at home. So, in this series, we'll be talking with pharmacists and other professionals and providers who work closely with patients every day so that you can feel more informed and confident going through treatment. Before we get started, just a quick disclaimer that this podcast is intended for educational purposes only. We may discuss medications that have off label uses, so this is not to be taken as medical advice. Every patient's situation is different, so please always talk to your provider and pharmacist before you make any changes to your medications or your care plan. So, in our last episode, we talked about nausea and vomiting during chemotherapy and how to manage those side effects at home. So, today's topic is a really great next step. We're going to be talking through nutrition during cancer treatment. So, even when nausea improves and nutrition and diet may improve, it can still be altered. So, what should you be eating? What if nothing really sounds good? How do you support your body when your appetite just isn't what it used to be? Um, I'm joined by Madelyn Wilcox, who is a registered dietitian and a board certified specialist in oncology nutrition, and she works with patients in our network. She has extensive experience helping people through these kind of nutrition challenges that come with chemo, radiation, and survivorship and recovery. So she's here to share practical and realistic tips that you can use at home. So thank you so much for being here, Madelyn. Let's start out with something that many patients deal with. A lot of people going through treatment start losing weight unintentionally, whether it's from reduced appetite or lingering nausea, or they're just not really tolerating food very well. What do you recommend for someone who's losing weight during treatment, and what can patients do to help maintain their weight?
Yeah. Hey, Cassie. Thank you so much for having me. It's such a valuable resource that you guys are providing to patients, especially those who are struggling with some of these frustrating, undesirable side effects like, nausea, vomiting, poor appetite. Unfortunately, the weight loss during treatment, it's a pretty common thing in this field, the oncology field, even beforehand, before people get started on their treatments, whether that be, chemo, radiation, or a surgery. But thankfully, with a little help and strategic eating, we can usually get the weight loss to stabilize or try our best to. So, the first thing that I do like to try to explain to my patients is kind of why their weight loss is occurring. More times than not, it's just because our body is really working super hard to fight the disease. And then, adding treatments to that, it requires a lot of energy. So they're kind of getting double whammied with this nutritional demand. But as you mentioned, with some of the nutritional side effects that they have, nausea, poor appetite, they're maybe eating less than they ever have before. So, if their intake isn't the same, but their needs are much high, we now have a situation where, it's just the weight doesn't kind of stay like it used to. So once patients understand this concept, it's a little bit easier to kind of get them on board and to maybe make those necessary changes to prevent some of that continued weight loss from occurring because they realize they do just have to be a little bit more strategic. Um, One of the most common recommendations that we do recommend patients try to adopt is kind of this mini meal mindset. So even if the volume of their eating goes down, so say, they're not having breakfast, lunch, and dinner in the same standard size, we get their frequency of eating to go up. So that kind of makes up for that lack of volume or less volume. So a lot of times this could look like 5 or 6 or sometimes more, small, frequent, balanced episodes of eating throughout those waking hours of the day. After this framework is established, usually our next tip, typically, or our next, I would say, trick, typically involves kind of using these calorie or protein boosters. Some examples of those could be things like, an extra dollop or drizzle or smear of, let's say, full fat yogurt or an extra drizzle of olive oil. extra schmear of peanut butter, almond butter. But basically, when we have this framework of eating, so our mini meals, and then we do these little small boosters, you know, before you know it, on average, you can get someone a couple extra 100 calories a day without them really feeling it's too much more in volume. So just seems to be a pretty approachable way for patients to kind of focus on weight stability and prevent some of that continued weight loss during their treatments.
That's all really interesting. I feel like I've never thought about diet during treatment the way you just explained it. That they're expending so much more energy from just fighting the disease and their body trying to recover from treatment or radiation. So they are having an even harder time just keeping up with their own metabolism. So like that, I feel like that's just something that probably nobody really thinks about. And I also just love the simplicity of just adding some foods with like higher fat content that are low volume but add calories really quickly. Like you don't always have to be turning to something like a protein shake that may not always be as appetizing, or at least uh, to me, it doesn't seem as appetizing as having like a spoonful of peanut butter. So I feel like those are already like really, really valuable tips for patients. But sometimes, I have heard from patients that, they may not have, like, a problem with appetite, but food may have lost its taste or it tastes really different. Even a personal example, I had a family member who was going through, full fox treatment, and, he had just been complaining that, food, it doesn't taste the same, it all tastes really bland. Like, I specifically remember him saying that, food tasted like cardboard. So do you have any practical suggestions for patients that may be dealing with loss of taste, or sometimes there can even be like a metallic taste?
Yes. Oh my gosh, that's so frustrating when that happens. And it gets people pretty discouraged because all those foods maybe like they once liked, they just don't taste good anymore, or they just don't taste like anything, as you said, like cardboard, bland. We hear those descriptors a lot. And that's where, as dietitians, and one of the things that drew me to dietetics is that, we kind of have this, obviously, this science background, but many of us, if not all of us, love to eat and cook, and we have this kind of culinary passion as well. So there's actually, it came from the culinary world, but there's this concept called FASS, FASS. It stands for fat, acid, sweet, and salt. And we give these guides to our patients because when we can kind of at least identify, okay, bland is coming up, we can usually like recommend either, okay, add a little acid and maybe a hint of sweet to combat that or to perk up the taste buds or brighten the flavor. So honestly, the thing that we do in this situation is kind of working with them from the culinary standpoint and help them determine what exactly needs to be added or enhanced about their meal to try to make it a little bit more appealing. Another thing that we do is we, kind of remind them that it's okay that like old foods don't taste good, but remember that foods maybe you didn't like might taste good because it's kind of the roles reversed. But so there's just a lot of encouragement. But for example, too, like if something tastes, let's say salty, so not cardboard or bland, but let's say salty, our flavor, like our workflow would tell them to incorporate a little squeeze of lemon or a lime or a few drops of vinegar. And caution here, like if you do have mouth sores or esophagitis or something, say you're also getting radiation to the head and neck or the, esophageal region, you would not want to use the acidic component because it can burn and kind of make things worse for another reason. But yeah, trying to just like get them a little bit more uh, kind of heavy-handed with some of these condiments and even building out kind of a condiment cart that they can kind of keep with them or just tool in their toolbox to get their meals to taste a little bit better. Another kind of reminder is that when we say things like, acid, explaining that that doesn't just mean vinegar, but it does mean citrus or, those types of things. And then with salt, doesn't just mean table salt, but things like soy sauce or coconut aminos or tamari or even Worcestershire sauce has worked for people. Just anything that kind of has that umami mouthfeel to it. So yeah, just basically trying to tackle these taste obscurities with a little bit of culinary edge. So, and one more tip I should say too, you can always add more flavor, but it's really, really hard to go backwards. So don't go like heavy on the vinegar. Maybe start with a few drops and then you can kind of titrate up as things start to maybe taste like you're moving in the right direction.
I like that it's kind of, encouraging patients to experiment with different flavors and different ingredients, and, I like that these are just, like, little tweaks and additions that, uh, I, again, would never have thought about as a pharmacist, so, I'm glad I have these, tricks that I can have in my back pocket now to offer to patients if it comes up offhand, but you know that we'll be, referring them to you all, on the dietitian side. But some chemotherapies or immunotherapies or even radiation to certain areas can cause side effects like dry mouth or mouth sores, like you were just talking about with wanting to avoid any like extra acidic foods with mouth sores. So I think I could make an entire separate podcast about management of mouth sores pharmaceutically. But what other measures would you consider for managing those kind of side effects from the dietitian's perspective?
Yeah, I feel like a lot of these things could have their own podcast because
Yeah.
they deserve they deserve the time to explain to patients so, people can keep eating. But yeah, some of the main nutrition focused tips for mouth sore management at least would be adjusting textures and to lessen irritants. So for example, with like the textures, you want to be thinking more soft, smooth versus crust like crunchy or crispy or rough. And then after you've got your texture modified, try to think, is there any irritant in here? So even things just like innocent black pepper, I've had that just light up someone's mouth before because they're just that, those mucosal membranes are just that sensitive. So omitting some of those spices or tang or tart or like we said earlier, acid, um, would be where I would start. So for example, if someone reported to me, hey, my eggs on my avocado toast with my red pepper flakes are not doing good, I might ask them to consider maybe a frittata instead. So a frittata is different than a quiche because it's just a bake with no bottom to it. So it can be soft and you can saute a lot of veggies before you bake the frittata, but that person could still have their egg-based meal. You could still top it with some soft avocado, and maybe get them to try some other herbs, as opposed to needing pepper or, even too much salt sometimes. So it's kind of a win for us too, because we're getting a lot of those, extra phytochemicals from our herbs like basil or oregano without the burn from maybe the pepper or the red pepper flakes. So that'd be for like a mouth sore situation. As for dry mouth, a lot of times this could be a simple fix. Sometimes it's just not in our control, but correcting any inadequacies with fluid intake does seem to make a big impact on those dry mucosal membranes. This includes people's eyes. We hear a lot of times people will be like, "Man, my eyes are just so dry all the time." And a lot of people don't realize that just as our calorie and our protein needs are at an all-time high during treatment, so are our fluid needs. So, the standard phrase I hear is, "I'm not the best water drinker." Well, now you have someone who's on treatment who really needs to be drinking to kind of filter out those, chemo byproducts, which I know you can speak more to, but we have someone who's already maybe chronically dehydrated, or inadequate with their hydration, and then they need it even more. So you just, your body feels those effects at a much more serious level. And if you have any questions on your fluid needs, you can ask your provider, or dietitians also calculate those when they're doing kind of those estimated nutritional calculations.
Yeah, I feel like, when I've counseled patients in the past on chemotherapy and hydration came up, like, I feel like we hear that a lot too, like, "Oh, like, I really, like, don't actually drink too much water throughout the day, or I'm not a very good water drinker. It's hard to keep up with. Like, I feel like water intake is always a challenge, whether you're going through treatment or not. Like, it can be hard to remember, or people just don't like to sip on water throughout the day since they may prefer something that has more taste to it. And like myself included, like I'm guilty. Like I have my water bottle like sitting next to me all day, but it doesn't do me any good if I don't remember to grab it and sip. So it's a good reminder for all of us to stay hydrated and carry a water bottle around with us. The next question I had for you, many patients are familiar with nutrition drinks like Boost or Ensure, and patients can even get prescriptions for these supplements. And I've seen prescriptions for something like Boost come across my orders on an EMR. So, are these helpful for cancer patients? And when would you suggest someone use these? And are there any pros and cons to be aware of?
Yes. So this is a great question too. So we get asked this a lot as dietitians, should I just start drinking a Boost, or my wife bought me some Boost, or my neighbor church members brought me some Ensure. Um Now, don't get me wrong, if you are struggling to eat, we're always going to tell you any calorie choice is going to be better than just eating nothing. So in those really low appetite periods, just do what you can to just eat or drink anything that sounds good. There's no use in abstaining from eating just because it's not, quote, the healthiest thing that you could have. We're gonna feel those effects a lot more if we, miss those episodes of eating. I would say if you have the energy to make something and there's no food aversions going on, I would try to make your own version. And that's what I typically recommend to my patient population is, if you've got a little, NutriBullet or a Vitamix or a blender of any sorts, I can kind of guide you with some recipes that one are way more whole foods based, so more nutrient retention, not as processed, not as much added sugar, but what's even greater to me is that I can usually get way more calories and way more protein than what you would be getting in, a 210 calorie boost with 8 grams of protein. Or some of them are doing better where, there are 350 calories and 20 grams of protein. But again, it's totally up to the patient's availability, to purchase those two. I know you mentioned the prescription, and there still is a little bit of a, I would say, struggle there with insurance kinda covering those oral supplements, but, it's always worth an ask to your doctor, your provider, see if we can at least try to submit it. But yeah, making your own is what I would say would be my recommendation there. And, again, if you have questions or you need recipe ideas, that's where your dietitians can come into play.
And I feel like, having the opportunity to make your own, like you said, if you have the energy to do that or you don't have, significant food aversions, like, I feel like that's another great opportunity to add, like, those, uh, m more, like, higher calorie ingredients without even, like, tasting them or if you do wanna taste them, like, if you wanna put, like, peanut butter in a shake, like, that's a really good opportunity. But again, like, these are things that, as a pharmacist, like, I hadn't thought of that, you could be making your own less processed version of, like, a protein, or calorie supplement, but it is always nice to have those as a backup, like you said. Um, Shifting over to food safety, depending on a patient's diagnosis and chemotherapy regimen, they may have a weakened immune system at some point during their treatment. So, are there any foods that they should be avoiding or take extra caution with?
Yes. So there used to be with our population, our oncology population, a very strong recommendation to follow what we called the neutropenic diet, which you may or may not remember hearing. But I will say in the past decade, more emphasis has been placed more so on like proper food handling, washing, storage versus avoiding fresh fruits and vegetables, et cetera, which was essentially the neutropenic diet. A lot of the rationale was like, well, they could contain bacteria and blah, blah, blah. But, these foods are actually what are very healing, to a patient. They contain vitamins and minerals and antioxidants and, fiber, which is an cancer nutrient we're finding in itself. So, thankfully, those recommendations have, I believe, as of like 2015, um, kind of lessened and more so, sourcing from reputable suppliers, not purchasing food past the expiration date, washing it thoroughly, consuming it within a day or two at the most. I think 48 hours is kind of the last point, not doing the sniff test of food, which I think we're all guilty of. This isn't the time to play around with maybe foodborne illness or not. So, you know, trying to be smart with that kind of stuff and eating the colorful fruits and vegetables, the foods that we call that fight cancer. So the American Institute for Cancer Research has a whole page on foods that fight cancer. It's like I think 24 or so of them, but surprise, they're all plants. So I think it's good that we've moved away from that neutropenic diet and more to just like, hey, be smart with your sourcing, don't eat rotten things or don't try to push it, but focus your diet on these things. And we keep talking about like when you're able, when you have, energy. So I know I say this with a lot of, liberties, but like one of the safest things you can do or as a patient can do is to cook for themselves and prepare their own meals. So all of those safety measures can be confirmed. But as we said, unfortunately, we don't always have that energy. Chemo might be kicking our butt, or we might just be super fatigued from radiation. So, if we do outsource these to someone else's kitchen, or restaurant, we need to know we're kind of taking a chance that, it could be compromised, but stressing and communicating to those people if you can that, please just know I'm in a really delicate spot with my ability to keep my immune system, functional. So, yeah, if you can, trying to do as much in-house would be good and keeping people in your corner to help you, and even working with us, as oncology dietitians, we work with caregivers quite a bit actually, on the phone to help guide them with purchasing and how to prepare things safely. So, again, reaching out and knowing you got a lot of people here that can, help answer those questions.
Yeah, I love, trying to get, the your caregivers involved more, because it doesn't all have to be on you as the patient, like, you can, lean on others in your home or friends in your circle to help and ask your dietitians about these things too, but yeah, I definitely have heard of that, like, neutropenic diet before, but I'm glad to hear that there does seem to be, like, some more flexibility added to that now. Um, and I like that it does make a lot of sense to try to maintain better control by trying to prioritize eating things that you have cooked yourself or your caregiver. But yeah, overall, glad that there's a little bit more flexibility. So, there's so much information floating around online, and on social media, and not all of it is helpful, as I'm sure you are well aware. But I'm curious, what are some of the biggest nutrition myths or misconceptions that you hear from patients, or that you see on social media or on TV? And, like, how do you, typically respond to these things?
Oh my gosh, this is a big one. So the questions never stop. And I'm grateful for it because one, it keeps me learning. So I am always like scrubbing through, PubMed or like trying to look things up when I don't know the answer to something, or maybe it's been a little bit and I want to see if things have changed. So one, yeah, it's good because it keeps me like agile and on my toes and hopefully competent. But two, I do appreciate the questions too because it means my patients trust me enough to want to have that conversation together. Some of the biggest misconceptions right now, and that's kind of interesting because I've been working in oncology for over a decade, and they kind of like go away and then they surface again, and then they go away and like a new thing comes up and then it surfaces again. But right now, again, for sure, sugar and cancer, soy and cancer, alkaline diets and cancer, and then probably this like heavy use of supplements in cancer. Um, and usually, like, the way that I go about, having this or the way I typically respond would be just out of a place of curiosity initially. I never want anyone to feel judged or that I think they're, an idiot for asking us or whatever. I'd never want them to feel self-conscious because I want them to keep coming back to, reliable, evidence-based nutrition, which is what we provide. And I do know they're just trying to do the right thing. So once I can understand, like, hey, where did this come from, or why did you want to talk about this supplement? I can kind of talk about, like, from a scientific perspective and give them kind of a lowdown on that. And basically, it just sometimes comes down to a simple little physiology lesson of, like, you know what, we're a human body, like, we aren't a petri dish, and this is how things are going to be a little different. So it's just a lot of curiosity followed with education, which is our job. So
Yeah, and along the same lines, you had mentioned, sugar and cancer being one of the, more frequent things that comes up in your conversations. I wanted to ask you about, this specifically. I feel like this is like you said, it's been getting a lot of attention, like the keto diet and low carb diets and how they relate to cancer treatment. So some people, may have heard or believe that cutting out carbs could starve cancer, but there's a lot of conflicting information out there. So I'm curious, what is your take on that? Is there any reason that a cancer patient should or shouldn't try a keto or very low carb diet during treatment?
yeah, that's actually a great addition to the last question because it does kind of, lead right into that. So we hear this a lot, and the like you said, social media too is just bombarding patients with this concept of, like, don't eat sugar and your cancer won't grow. But currently, this isn't an evidence-based recommendation or standard of care to follow a very low carb diet. In fact, if you actually look at the current nutrition recommendations for the American Institute for Cancer Research, at any point in the cancer continuum, so pre, during, and post treatment for, like, disease prevention, recurrence prevention, it is to adhere to a plant-based diet as best as possible. And as we know, like with plants, they're gonna be higher in carbohydrates, hopefully through whole, minimally processed sources like vegetables, whole grains, fruits, beans, legumes, herbs, spices, etc. And there's other things with a plant-based diet like nuts and seeds. But these are actually the foods that we have the most amount of literature supporting, as they contain a multitude of cancer-fighting components. So it is actually quite opposite to, let's say, a keto diet, which is maybe 5% carbohydrate based at some of the strictest levels. So there's not a big opportunity to get all these great cancer fighting foods. So, for that reason, I recommend patients try to stick with what we know. And if anything changes, I will absolutely keep them, up to date on that. So focusing on what we get to add is always a great perspective. And there's enough fear and worry. My job is to definitely empower patients and make sure they feel confident. And I feel like focusing on the positives and what we get to include in our diet to keep us healthy typically, works out for the better.
That's all really encouraging to hear about, keto and sugar with cancer. Like I feel that maybe as we learn more, then that may be something that we can approach with select patients. But I feel like I hear so often patients or people in general just trying a like keto diet and maybe it works really well for some people, but a lot of people I feel like they really don't feel good on a keto diet or when they finally like reach ketosis. And I feel like for patients that are going through cancer treatment, we really want them to feel as good as possible. Like we don't need to be adding more stress in that way. So that's really reassuring. But really, that wraps up our episode for RxConnect. So thank you again so much, Madeline, for joining us and sharing such helpful advice on nutrition during cancer treatment. These are the kinds of practical tips that I feel can really help patients feel more confident and supported as they start therapy and even into maintenance and survivorship after treatment. So at your next appointment, make sure to ask your doctor or nurse how you can get in contact with a dietitian. if there's one available either on site or remotely, in my experience, they'll always go out of their way to support you. So whether you're dealing with a low appetite or unintentional weight loss, or even medicine side effects like dry mouth or mouth sores that we talked about, a dietitian can help you feel better and start feeling a little bit more like yourself. So thank you so much for listening. We'll be back next month with another topic to help support you during treatment. And if you found this helpful, we'd love it if you shared this episode with a friend or family member.
The RxConnect podcast is produced by the pharmacy operations team here at American Oncology Network and music composed by the Synth Dude. Make sure to check out all our episodes of the podcast by liking and subscribing to our YouTube channel.